thank you all for coming to our webinar today. I'd particularly like to thank the Public Sector Innovation Network for including us in Innovation Month as one of the presenters. I'm Catriona, and this is Alex from IP Australia, and we'll just start with a very quick housekeeping. If you could please make sure you keep yourselves on mute, that will help with background noise. And we're also turning off people's video just so that we can make sure the streaming is the easiest possible for everyone. And you can see on this background slide, we will have questions and answers at the end, and you'll be able to join us on Slido with the code IMIP. Thank you, Liam. So we'll get started with my slides now. Thank you. Thank you all for joining us today in a story of knowledge, innovation, and resilience. We're going to talk today about what we can do for you, how IP Australia is playing our small part in the puzzle of fighting the pandemic by making our specialist resources publicly available and accessible to everyone. Then we're going to leave you with the tools to take a deep dive into this information so that you can come up with your own ideas, questions, and solutions. As part of the theme of knowledge, innovation, and resilience, I acknowledge the Ngunnawal people, the traditional owners of the land on which we're standing today in Canberra, as well as the traditional owners of all of the lands where everyone in the webinar audience is from. As we speak today, we're gripped by cold and windy weather, and for thousands of years, the Ngunnawal people have lived on country here, which has required deep environmental knowledge, innovative ways of living, and, above all, resilience. I pay my respects to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples attending the webinar today. Over the next 30 minutes or so, Alex and I are going to talk about knowledge, innovation, and resilience in the face of the COVID-19 pandemic. I'll start off with introducing you to our knowledge, or what we thought we could do to help, and then Alex will talk about innovation, what we have made, as well as an insight into global innovation, and he will finish off with resilience, how we can use these tools and information to help build a resilient response to the pandemic. So we'll start with knowledge, or what we thought we could do to help. Some of you might be wondering what IP Australia, a government agency responsible for administering intellectual property, or IP rights, could possibly do to help the pandemic response. Well, first up, although I wasn't personally involved, I'm proud to be part of an agency that has worked so hard and as hard as we can to pull together and support our Australian business and individual customers as they get through this hardest of times. And we've been able to do a bit more as well, which is what we're focusing on here today. This is about our people, our expertise, and our tools. At IP Australia, our people include hundreds of expert professional scientists and engineers. As soon as the pandemic was declared, everyone was asking, what can we do to help? How can we share our knowledge and ideas quickly with people who might find it helpful? So we took stock of what we have. As well as professional expertise and analytical capability, we have access to global patent records. Every patent filed gives information on who the applicant and inventor are, where they're located, and what technology they're working in. and we have details of over 250,000 different technology classifications. And as well as this, there's information on where people are seeking patent protection. With over 120 million patent records available across the world, all as open, publicly accessible data, this is a rich source of information on trends in innovation, how technologies are developing over time, who are the key players, who is collaborating, and where technology is being commercialized and manufactured. So our aim was to take this huge amount of patent information, extract the parts that are useful to the pandemic response, and present this in an interactive format that is accessible to everyone. And as well as this, we've also built RSS feeds to make our in-house information services publicly available by gathering all relevant research and news articles together in one place. And I'd like to thank the many people from different groups across the agency who came together and worked quickly to develop these tools and resources so that users across the world can come up with their own ideas, questions and answers, and ultimately find out information that can help build our national and global resilience to the COVID pandemic. Now I've run through some of the knowledge that we have available and how we thought we could help, I'm going to hand over to Alex, who will take us through the next steps of innovation, or how we have presented this information in new ways, and resilience, with case studies of how the information might be used to support the COVID response. And after the webinar, we'd encourage you to get online and dive into our interactive visualizations yourself. Thank you. Thank you, Alex.
Thank you, Kat, for your introduction. Before I proceed further, let's recall where things stand as IP Australia begins considering how it can contribute to the COVID-19 response. It is mid-March. The pandemic has officially been a global emergency for less than 2 months. An unprecedented global research and development effort is underway to understand the virus and to develop vaccines and treatments for it. Governments around the world are grappling with the myriad challenges created by the escalating pandemic. Australian government task forces are working hard to address the challenges of COVID-19. These include ensuring, first of all, that our health professionals have sufficient and continued access to the medical supplies and equipment they need in order to fight the spread of the virus and treat those infected. And secondly, Australia is able to promptly access drugs and vaccines against this virus if and when they become available. The threat of shortages in personal protective equipment, so gloves, masks, goggles, to protect health workers, test kits to identify those infected, and respiratory support equipment to treat the sick who develop lung complications means there is a need to identify new suppliers, boost local manufacturing where possible, and even explore repurposing of related products. This need raises questions about who and where there is know-how and capability across a range of health and related technologies. And IP Australia can help provide answers to these questions, using our data analytics and expertise to interrogate the millions of patent and other IP records we have access to. And that is precisely what we did. And I'll now show you, start going through my slides. Within a couple of weeks, we were able to generate a global picture of patenting activity for each of 6 technology areas that were key to the COVID response: respiratory support devices, face shields and masks, gowns and goggles, vaccines, drugs, and diagnostics. We also analyzed domestic data on Australian IP rights in designs. These are the unique shapes of commercial products, and in trademarks, which you may know as brand names, which were associated with those same technology areas. Protection of design and trademark rights is associated with commercial success and therefore provides a valuable link to on-the-ground production capability needed for the COVID-19 response. What's more, to supplement our analysis of IP data, the agency's research and information services performed other literature searches in the relevant technology areas. The key insights from this body of work were then provided in early April to the corresponding task forces on ventilators, personal protective equipment, medical supplies, and testing kits. For each technology area, the insights we provided can be summarized as consisting of the following elements: who the top global innovators are and which country they are based in, which global innovators are active in Australia, and who the Australian innovators are. Having provided this information, we then set about packaging our patent analysis in a form that would allow anyone from around the world with little or no prior training in IP or in the tools we use to explore the global patent pictures around these 6 technology areas we examined for the COVID-19 response. These interactive reports were made available to the public on our website on the 6th of May, and I would encourage you to take a look at them. They are informative and easy to use, making no assumptions about who is viewing them and allowing a person to ask their own questions of the global patent data and gain their own insights. We have been reassured to observe that the number of visits to the web page hosting these reports more than quadrupled since the reports went live. And being analysts, we felt compelled to look at this web page visitation data in a bit more detail. So we made a map. This map shows the number of unique views of our web page from outside Australia for the period of 6th May to 30th of June 2020. The size of the circles tells us the number of views. As we can see, these views have come from around the world, 46 countries, including a number of low and middle income countries. This picture is very encouraging for us. We want the information we have generated to be available to and accessible by anyone who needs it. This is because pandemics do not recognize borders, and yet few countries have access to the kind of resources needed to perform the analysis we have done. What's more, we've been encouraged to observe that there's been considerable interest in all 6 of our analytics reports, as shown here by the number of public reviews they have each received. Okay, so up to now, I have spoken in general terms about the insights we were able to gain from IP data during our COVID-19 analytics work. For the remainder of the talk, I will look in more detail at 2 of the technologies we examined. These are respiratory support devices and human coronavirus vaccines. We'll start with respiratory support devices and more specifically ventilators. Medical ventilators are a category of respiratory support device that have proved important in treating COVID-19 patients. Although primarily interested in medical ventilators, we decided to cast the net wider in order to gather information about other respiratory support technologies that could be of use in the COVID response. The questions we were particularly interested in answering were the countries and innovators having know-how in invasive medical devices. These are the intensive care unit ventilators requiring a tube to be inserted in the patient's airway in order to treat those with the most severe symptoms. Non-invasive medical devices useful in treating patients with less severe symptoms. Non-medical equipment that could be useful in building capability by repurposing for medical use. And parts important in maintaining existing stocks of medical equipment, as well as repurposing other equipment for medical use. Now, to an informed Australian audience like yourselves, asking who has know-how in ventilators has probably a very obvious answer: ResMed. We all know that ResMed is the Australian manufacturing company that our government has been purchasing ventilators from for its COVID-19 stockpile, and which has been ramping up its production since April 2020. So while not surprising, it is reassuring to us that ResMed popped out of the data analysis on ventilators in quite a big way. But there is much more the data analysis has told us. What I'm showing is a snapshot of our ventilators interactive report generated from over 60,000 patents we identified as relating to the technology area of respiratory support. What you see on the right is the list of innovators in this technology, ranked by the number of patents they have filed. And there is ResMed in the top 3 global innovators, along with Philips and Fisher-Paykel. You only see the top 8 innovators in this snapshot, but the list is in fact quite long. The map on the left shows us which countries the innovators originate from. So at a glimpse, our analytics revealed that know-how in this technology is spread over a relatively large number of innovators and countries. This indicates that decision makers around the world have some flexibility in terms of who they can approach to help support their COVID responses. That said, you'd expect decision makers to consider the leading innovator first. So that would be Philips then, right? Well, it's not quite that simple. It really depends on what you're after. When you look at the 60,000 patents relating to respiratory support technology, you see patents relating to complete devices, and then other patents relating to device parts. Patents on devices for medical use, and others on non-medical use. Patents on invasive devices and patents on non-invasive devices. And then other patents that are more broadly relevant, but don't really fit into any of those other categories. And once you start looking into each of these categories, you see that the innovators have particular areas of specialization. So it turns out that in terms of complete medical devices of non-invasive use, ResMed leads the field, while Philips is the global leader in medical device parts. And neither ResMed nor Philips have a dominant position in the area of invasive medical devices. This is Covidion's domain. And to avoid confusion, that is the company's actual name, and it has nothing to do with COVID. Going a step further, if you are interested in non-medical devices, then 3M is the leader you want to be looking at. What these examples illustrate is the nuance hidden within patent data that we were able to bring out through our analytics, giving us insight that would be difficult, if not impossible, to arrive at otherwise. And it was these insights about the relative specializations between innovators that formed a key component of our advice to the ventilators task force in April. I also want to briefly walk you through some insights we gained in the area of vaccine technology. I need to stress at this point that I am not talking about vaccines against the particular virus responsible for the COVID-19 pandemic. There is an unfortunate delay between IP data being generated and our ability to access it for our analytics work. This means that all of the data we used for the work we have been talking about today predated the pandemic. And because the COVID-19 virus was not known to science before the pandemic, any vaccine development against it could not have occurred during the time period we have data for. Instead, what we focused our analysis on was other members of the same family, the coronaviruses that infect humans. And what our analysis showed was that vaccines against these viruses represent a relatively small field of innovation. What you're seeing is a snapshot from our interactive report on vaccines. And what it illustrates is the relatively small number of innovators and small number of countries where innovation is occurring in this technology area. What's more, this is a field that has been dormant. I'm showing you another snapshot of our interactive report showing the timeline of patenting activity in the area of human coronavirus vaccines. Now, this graph is intended to illustrate several different points, but what it makes clear is that there has been virtually no activity since the SARS outbreak in 2003, while the much smaller Middle Eastern outbreak of 2015, known as MERS, which was also caused by a human coronavirus, coincided with barely a perceptible blip in patenting activity. So put together, what we were looking at was a small field of innovation, only covering viruses similar to the one causing COVID-19, and to cap it all, the field had more or less been inactive for more than 15 years. At first glance, this is not a very promising place to be looking for insights to support the COVID-19 response. However, as we were performing this analysis, the non-patent literature our research and information services was pulling together kept highlighting that knowledge and experience gained in developing vaccines against related human coronaviruses was precisely the ticket to success for a COVID-19 vaccine. So we persisted and turned our attention to the vaccine strategies employed in the 1,400 odd relevant patents we had at our disposal. So what do we mean by vaccine strategy? Well, all vaccines aim to do the same thing: introduce the disease-causing pathogen to our body in a controlled way that will not cause the disease itself, but will allow our immune system to prime itself so that when we get infected with the pathogen for real, our immune system can recognize and respond to it quickly before it has time to take hold. However, there are a number of ways or strategies that can be used to achieve the same. And while these strategies address various aspects of vaccine development, one of the key elements these strategies address is what form to introduce the virus in. Each of these strategies have advantages and disadvantages and have to be tailored to the pathogen in question. So when we looked at our coronavirus vaccine data, we observed that they fell into one of three categories: vaccines that used only small parts of the virus, known as subunit vaccines; vaccines using the complete virus in a form that can infect the cells of our body, but has been weakened or attenuated, as it is called, to the point it is no longer able to make the recipient ill; and thirdly, vaccines using the complete virus in a form that is inactive. It can no longer infect or cause illness. And what we saw was a clear bias in the type of strategy used for human coronavirus vaccines, with subunit vaccines having been most favored by innovators working on human coronaviruses, followed by attenuated virus vaccines, and finally, inactivated virus vaccines. And of importance to Australia, while only having 2 active innovators in the area of human coronavirus vaccines, University of Queensland and CSIRO, UQ had expertise in the subunit vaccine strategy, and CSIRO in the next most favored strategy, which is attenuated vaccines. So through our analysis, we were able to identify that a particular vaccine strategy has been historically favored by innovators developing vaccines against human coronaviruses, and that Australia has expertise in this particular vaccine strategy. These are valuable insights for governments making decisions about which vaccine candidates and which institutions engaged in trials to focus attention on and, where necessary, provide support to. And our findings are validated by real-world events. This graph, published by The Economist, shows that as of mid-April, there were more COVID-19 subunit vaccine candidates in development than in any other kind. And a month later, the Swiss RE Institute reports that subunit vaccine candidates are still in the lead. And then again, on 13th of July, it was announced that a subunit vaccine candidate against the COVID-19 virus being developed by the University of Queensland reached a major milestone by entering human clinical trials. Hey. The work I've described up to now is just one way in which IP Australia, as a whole, used its knowledge and capability to support the COVID response. Centipede is one other example. This is a flexible and modular media monitoring application, given its name because it is possible to create many legs or iterations of the product grouped into customized subject or topical views. Centipede has been in use within IP Australia for some time in various forms and versions. Versions of it have also been made available to other government agencies, such as the Australian Public Service Commission and the Australian Government Solicitor. It has proved a valuable information resource because of its ability to quickly build and add content from many disparate sources, which makes it stand out from other products of its type. In response to the pandemic, our agency created a publicly available version of this tool to provide a single point of access to the latest global news, research, technical developments, and insights on COVID-19. So how does it work? Quite simply, Centipede monitors a large number of online information sources. These are both free and subscription sites for new published content. It filters for relevance and makes the information available in near real time through a web application. And this is what it looks like. The gathered information is presented in one of 3 content windows, allowing users to easily follow the latest updates in COVID-19 technology, manufacturing, or research. Users can scroll through the content windows to browse. They can click on headlines to view an article in full text, or subscribe via an RSS feed in a reader of their choice. The app also includes a search function, allowing users to search for older information no longer appearing in the content windows. As we reach the end of our presentation today, it is important to reflect that the COVID-19 pandemic, which continues to unfold around us, is not just a story of suffering and hardship. It is also a story of resilience, knowledge, and innovation. Hopefully, what Kat and I have been able to do is give you a glimpse of this resilience and innovation seen in the COVID-19 responses to date at national and international level, and in how IP Australia has used up to now its knowledge and ability to innovate in order to support that response. The fruits of our agency's efforts today, IP analytics on key medical technologies, and real-time sharing of the latest COVID-19 news, research, and technical developments were the result of a collaboration by over 40 individuals from across the agency's business groups. We want to take this opportunity, once again, to acknowledge their contribution and to thank them for their efforts. And these resources we have generated are freely available to all. So in closing, we would like to invite you to access these resources and use them to ask your own questions and gain your own insights. Thank you.
And so now, thank you, Alex, and thank you everyone for your time in coming to our webinar. We're particularly interested in the next step, which is the Q&A, to see how we can improve and how this might be interesting to you. So if we could go to the next slide, please, then the Slido is open and we will go to view the questions. The code for Slido is IMIP, Innovation Month IP. So thank you. We'll head over to Slido now. Okay. So we've already got some questions there. Thank you for putting those in. So Alex, maybe you might like to, should we look at the first one?
Okay.
Why did you choose ventilators and vaccines? Was there any interesting information about other technologies like drugs and diagnostics?
Yes, far more information than we could possibly cram into 1 hour. We chose ventilators and vaccines for 2 reasons. They provide contrasting pictures of what you can, what information you can get from patent data. One area, ventilators being a very large field of innovation that's continually progressing, and vaccines being this much smaller field, which is very reactive and, as we saw, has been dormant for some while. Additionally, we noticed when we were looking at the most recent numbers of views of our reports that ventilators and vaccines were at the top of in terms of number of views. So clearly there's been interest in them, and we thought it would be good to explore them a bit further with the audience. And finally, ventilators and vaccines have also been in the media a lot lately, and so they're of current interest. Hope that answers the question.
So we go on to the second question. Who has used the work you've done and what for? So that's a great question. Thank you. Shall I take this one?
Yes, please.
We'll have a change of speaker. So the work, as you know, we started the work once the pandemic was declared, and we've been using that and providing that, working to support the Department of Industry, Science, Environment and Resources, who have been set up and run task forces as a central coordination point across the Australian government. So our information has played a small part in the overall picture that the department's task forces have been looking at. It's as part of a small part of the puzzle. We can't tell you exactly what our information has been used for, but it fits as part of a larger picture in the national global pandemic response. We've also had some feedback from people overseas who, for example, in Oxford, who have said that this will be a good resource for their work in low to middle income countries, and we've had sharing in those areas. Once again, it's a small part of that overall picture, but we're very proud to have been able to make this contribution. So,
maybe you want to take this one too?
what's next for this work? Are you going to look at different areas? Thank you. So, that's a good point. What's next for this work is, in fact, we will look at different areas on demand. Primarily that's driven by other government agencies. So, for example, some of the subcategories within the interactives have been expanded following the initial work to include different areas of interest. And we're working with task forces, including the Department of Health at the moment. So these will change over time, and we will update the data when we have new data, as well as expanding them into other areas. There may be unfortunately, the pandemic is progressing, so what we're requiring will be developing. And again, it's just adding that bit more that might be helpful.
I think there was a related question about revisiting which has disappeared now, but I think you covered that in your answer. Okay. So,
okay. So this one, does the hub support all agencies, and how do they reach you with their requests? Yes, the hub does support all agencies. We can be contacted quite more straightforwardly through our website. There are all the contact details there. And our primary mission in the hub is to support government investment and government decisions. So this is both for government agencies in their policy making and strategic decisions in broad technology areas, and also for universities or publicly funded researchers. We want to maximise the value of government investment to the Australian economy. So please do reach out at any time to contact us. The next question is, it looks like your information is quite old. What can you actually tell us about COVID-19? You have touched on that a bit, but I think it might be worth reiterating. The context of the vaccines is quite good.
Yes, so it's an acknowledged limitation in that of our analysis, in that it doesn't capture the latest patent activity. There is a lag, and unfortunately that lag at the moment predates the start of the COVID-19 pandemic. So new activity that is directly the result of the pandemic is not visible to us at this point. We can extrapolate based on historical information and data for the COVID-19 response, as we have illustrated during the talk. But that, again, we will be able to revisit that data in some time once the patent data has caught up and we can look at how things have changed since the pandemic started. So we'll probably be able to provide more direct information for the COVID-19 in some time, but not yet.
Okay. Are other countries doing similar work? If so, how does Australia perform in comparison? So I'll take this one. Yes, other countries are doing similar work. Particularly, I've got to focus, because we're from IP Australia and we're a patent office, we have a fascination with what other patent offices are doing, but there are also commercial service providers who do similar work. So what other countries have done is a couple of things. They've done work to look at what patent filings are in the broad technology areas and made that information publicly available through drop-down lists of individual patents. And so that's a really great move. And so, for example, Korea, the Korean Patent Office has done that. And that means we have access to work done where the native language is not English. So it gives a completely different view, potentially, and more insight. The US has given and the European Patent Office has done a similar thing to Korea, and I understand the Chinese Patent Office as well. The US is an example of an approach where we've not only looked for that information, but seen what patents are granted and available for licensing. So there's various different takes on this, and it's really good to see so many people coming together. We've been fortunate enough in Australia to be able to work together with some patent offices, like the Canadian Patent Office and the UK Patent Office, to develop our search strategies and to support their work. So we're very grateful for their input. As far as we're aware, this is the first interactive type where we can drill down with the questions that we've got. But what the pleasure about this area is that with very many different takes from different countries and different providers, people can really choose what's going to be most useful for them as a tool.
Okay. Do you plan to revisit this work in the future to see how the patent landscape has changed? I think we have already addressed this. The answer is absolutely. We can't wait to be able to do that.
Okay. Will the Hub be able to support future potential requests from overseas? So as I've said, the Hub's primary mission is to support Australian development, research, commercialisation, strategic decision-making and policy with a view to improving and supporting Australian economic growth. Now, potential requests from overseas would be considered in that context. So we do examine very carefully who we're working with to make sure that our goals are aligned and our values are aligned. And so that's a really interesting question, and definitely one we'll look into as the hub matures and is evaluated in the future. I'm going to leave it to you to read the questions. My eyesight is not good enough.
Okay.
Yes. So a couple more questions.
Next question. There may be a disconnect between institutional or individual research and patent filings. Any step or incentive for them to come forward to file patents?
Okay, this is a broad and interesting question.
Yeah.
So I'm going to try and paraphrase the question. I think what we're talking about here is the difference, and this is a great question. It really goes to the heart of the journey from research through to commercialization and commercial success. And in Australia and in other countries, there's quite a challenge of moving from one space to the other. So I think what we are discussing here is the potential difference in policy direction between, say, a government or a university and the patenting approach they have for their researchers and the individual researchers themselves. There are many different ways to take that question, but this is the way I think that it's probably intended. So we're then asking, and yes, these can be distinct because the goals of an individual research or research project are distinct and have overlap, but they're separate from the goals of a large university, for example. They don't necessarily have to be, but commonly they are. That would be expected. So any steps or incentives for these to come forward to file patents? Well, IP Australia has quite a few SME, small to medium enterprise initiatives, and as part of the broader Department of Industry, Science, Energy and Resources, there are programs such as the Entrepreneurs Program, which support commercialization holistically. And I think these are probably the best overall picture of Australian government support or incentivization for commercialization. One feature of that is patents. There are many reasons why companies and individuals file patents or don't file patents, and that's not always clear-cut. It's part of a bigger picture, which does mean that it's important to put this in the context of business advice as a whole, otherwise from perhaps the business advice in the Entrepreneurs Program or the Growth Facilitator advice, or through a professional patent and trademark attorney. So yes, there are incentives, but they're not specifically targeted to individuals filing patents. It's more in the context of building the economy as a whole and supporting research and commercialization in the broader picture. I hope that's answered that question. If it hasn't answered the question, what I would suggest is you type another question, because we've got time.
Yep.
Next question.
Could this approach also be used for investigating other future global crises such as climate change? I'm not sure it's a future global crisis, but...
Future, well, that's semantics. That's,
okay.
Yeah. Would you like to take that one?
Well, quite simply, I would very much hope so. What our work did, our analysis did, when we looked at the unfolding real-world events, was that we saw that a lot of the insights that we had gained were then validated by real-world events. That tells us that this approach is valid and is useful, and so there is no reason why it can't be applied to any technology area, any crisis, any challenge. If it's technology related, and to a certain extent climate change is, then patent data holds valuable information, and we know how to unlock that.
And I'll just add to that, if you would like us to help you in your work in these areas, please reach out. We would love to be involved. And I think we've got one more question. That's also for you. I'm fun, sorry. Were there any surprises in your research? That's a great question, thank you. You've talked about a couple.
Yes, so to not start going down into some of the other technology areas we examined, I'll stick with the ventilators and the vaccines. I'll start with the vaccines. Possibly the big surprise was this bias in the vaccine strategy that has been used previously for similar viruses. And it wasn't something that was immediately apparent on the surface. When looking at the data, you really needed to drill down and split it into its various components before it started to emerge. And again, it was a surprise to us. And then we saw that it was validated in what was happening in the global vaccine pipeline and what's still happening in the global vaccine pipeline. When it comes to ventilators, I would say that you probably cannot predict. It's not perhaps a wow surprise, but you can't predict the various innovation specializations that companies and entities have in a field as broad and diverse as respiratory support devices. And so it was interesting to see that those who are engaged in non-invasive devices aren't necessarily the same companies who are dealing with invasive devices to the same extent, or at least innovating as much in both areas. And it was also interesting, and I possibly wasn't focused on so much for this talk, but that you had companies that were focused on both medical and non-medical devices at the same time. So they had quite a diverse portfolio. Again, not something you would necessarily know or be able to predict without looking at all of this patent data.
And I'm going to speak to the next question, which was, have we got any examples of how our research has been used by others? So with the COVID examples, I must emphasize that we are a small part in a much bigger picture, and it's impossible to disentangle that and point to this being that. So with the COVID response, I will set that one aside, but I would like to give you an example from a different piece of work that's not on such a grand scale, fortunately. We are fortunate that most of our work is not to do with the pandemic. And this is an example from a researcher, an Australian researcher, who was working on pollen allergens. And they were particularly looking at tropical pollen allergens, which occur in Australia, and combining those with a new but well-known delivery method to help people become acclimatized to allergens and reduce overall allergy burden. And our work showed that most of the companies in the world who are working on pollen allergens are working on those from temperate grasses that are found, for example, in Europe and the United States. Now, in retrospect, that's a very obvious finding, but for a researcher who's working on their own in one area and hasn't necessarily done much commercialization work, that's actually a really good and useful piece of information, because we also showed that there is room for investment from countries where there are markets for tropical pollen allergens, so in much of Asia. So this researcher was then able to use that information to support which direction they were going in and who they might approach for funding and collaboration. And this was then a success story for the researcher and ultimately for Australia, and particularly for allergy sufferers. I can't see the next question.
Okay. Have there been any specific links from your research results and the particular decision being made by government?
I think we've answered that before, but I would like to emphasise that we are one small part of that chain, and we do not have visibility on any of those particular decisions.
All I can add to that, seeing as this question has come up in various guises already a couple of times, we'll take ventilators as an example. So ResMed was a company an innovator that came up a lot in our analysis. We highlighted ResMed's strengths in the advice we provided to the relevant task force. Now, we can't see exactly what happens after that, but I'm reading from a quote from the Minister's office when it was announced that ResMed was going to be providing 3,000 ventilators for the Australian government stockpile. And I quote, "The delivery from ResMed follows extensive work across government." And that's as close as we can get
with that visibility.
Visibility.
And this also speaks to the next question, which we'll take, I think it's the last question. Did you have more questions from companies or agencies? So the answer is yes. What we've shown today is our publicly available information. We have answered some other questions within that, and we've also provided briefing of confidential and sensitive matters to broader agencies. We also have a large number of reports that we have not published on our website because they're commercial in confidence for researchers. So if you do have that type of work that you would like us to look at, we're very happy to take on confidential work that will support the government in its aims and researchers. So we really look forward to hearing from you. So I'll just wrap up very quickly.
Okay.
Thank everyone for coming. Thank you all for attending this webinar. And particularly thanks to the Department of Industry, Science, Energy and Resources, Public Sector Innovation Network for including us. Thanks to everyone across the agency without whom this wouldn't have been possible. And thanks to Alex for really turning what is quite nuanced and technical information into a story that's useful and easy to understand. Now, the next point I'd like to ask you to do is to look at those visualizations, see if you can answer any questions or where you think we might go, and come back to us with your ideas or take your ideas further forward. We'd love to hear from you, and we'd love to see what you're doing and to help you. Thank you, everyone.
I'll just finish by saying thank you to our technical team. You can't see them, but
there are 7. I just have to tell you, there are 7 laptops on the go. We've done a good job. Thank you, everyone.
Different experience without them. Thank you.